All right, so I consider that I have a little bit of OCPD, which is a little bit of perfectionism, but clearly not, because if you look at my hair, it's kind of a hot mess, and I'm okay with that because that's just life. It's kind of late and it's okay. But we'll talk about OCD. It's very, very disabling disorder, and there's many factors. So the O stands for obsession, C stands for compulsion, and it could be both. You could have both, so one or the other or both, and cause significant dysfunction. So these obsessions can be genetic and easily learned. So one way that I would recommend learning it is learning kind of the phrase, washing and straightening makes clean houses. And I'll explain. These are the classic types of OCD that people often do. So like germophobia, needing things to be symmetrical, having like rituals, like words or numbers that repeat, like I gotta do something 4 times, or I feel like anxious and like I knock the door 4 times before I leave. That's like a ritual. Checking things, like checking the locks a couple times, and hoarding. So hoarding now has its own disorder, but it's almost like obsessive and compulsive. Can't let go of things, though it can be. There's actually a lot of cases where people have so much clutter that it becomes very hazardous to their health. So washing and straightening. So washing your hands or other parts of your body. Straightening is ordering rituals, mental rituals like magical words, numbers. Checking, hoarding, which is now a separate disorder. But it's very disabling, and I will go over the different treatments for OCD. There are medicines that are very effective, but there's also different types of therapy like CBT that help you to break the cycle of OCD repetitiveness. Stay tuned for another chapter.